task force, prospective investors, and local pharmaceutical manufacturers, distinguished guests, media, ladies and gentlemen, I recognize as well the presence of Wanawake na Samia. I've heard they're here as well. Thank you very much. Good afternoon. Allow me to begin by thanking Almighty God for granting us this opportunity to gather here today in good faith, in good health. I also sincerely thank our Excellency Dr. Samia Suluhu Hassan, the President of the United Republic of Tanzania, for entrusting me with the responsibility of serving as a Minister of Health Sector. Her vision for this sector is bold, strategic, and long-term, particularly in the area of pharmaceutical production, which she rightly views as a cornerstone of health security, industrial economic growth, and national dignity. Honorable guests, distinguished investors, ladies and gentlemen, I warmly welcome you to this strategic forum. Your presence here is not incidental. It is a clear demonstration of our shared commitment to building a strong, competitive, and self-reliant pharmaceutical sector. It shows your readiness to join the President's vision of transforming Tanzania toward pharmaceutical regional manufacturing hub. The government recognizes pharmaceutical and health product manufacturers as strategic partners in safeguarding the health of Tanzania and our national journey toward self-reliance, regional and global competitiveness. I clearly understand that national health security cannot be built on dependence in imported medicines alone. It must be built by encouraging local investments, strengthening the capacity of our industries, and fully integrating them into regional and global value chains. Honorable guests, distinguished investors, ladies and gentlemen, we have convened today with a specific purpose to create an open, honest, and practical dialogue between the government and investors to showcase pharmaceutical manufacturing investment opportunities in our country, highlight government incentives, regulatory pathways, and support mechanisms, and facilitate networking between investors, manufacturers, government, regulators, and development partners. It is a critical moment to align and tap the prevailing opportunities in the manufacturing sector. Honorable guests, distinguished investors, ladies and gentlemen, over the past years, Tanzania has made a significant progress in improving access to essential medicines and health commodities. We have strengthened regulatory systems, improved the procurement supply chains mechanisms, invested in health infrastructure, and doubled the health commodities budget. However, we also recognize the reliance on imported pharmaceutical products poses challenges to affordability, availability, and the long-term sustainability of the health service provision. I understand building pharmaceutical industry is not just an industrial project. It is a strategic investment in health, the economy of science, and Tanzania's global standing. For this reason, the government has introduced the Pharmaceutical Acceleration Strategy to facilitate and speed up all the processes. we recognize that the pharmaceutical sector cannot wait for slow conventional decision-making processes. Given its strategic importance to national health, economic growth, and security, the government has established fast-track mechanism to remove structural bottlenecks and accelerate investment decisions. Under this strategy, licensing, permits, land access, taxation, product registration, and infrastructure provision will be processed concurrently rather than sequentially. The goal is to provide serious investors with clear, predictable, and timely decisions. To operationalize this, the government has established the Pharmaceutical Investment Acceleration Task Force, PIT. PIT has direct authority to coordinate and fast-track strategic pharmaceutical investment from project evaluation and approval to final implementation decision, eliminating bureaucracy delays. PIAT brings together decision makers with direct authority across policy, regulation, finance, land, energy, trade, investment, and public procurement. This ensures that the decisions are made decisively at one table with a unified national perspective. Through PIAT, Tanzania is creating a strategic window for pharmaceutical investors through transparent, time-bound, and result-oriented. PIAT does not only facilitate decision-making, it monitors implementation in real time. Honorable guests, distinguished investors, ladies and gentlemen, I'm pleased to formally announce that the government has issued and published an expression of interest, EOI, for investment in pharmaceutical and health product manufacturing. The EOI aims at attract local and international investors, facilitate partnership between local manufacturers and global partners, mobilize capital, technology, and markets, and accelerate attainment of international standards, especially GMP and WHO PQ. The deadline for submission is March 2nd, 2026, underscoring our commitment to speed and take decisive action. Honorable guests, distinguished investors, ladies and gentlemen, allow me to outline the key national objective guiding the development of pharmaceutical manufacturing in our country. First, to build national health sovereignty and security. A country that produces its own medicine is better positioned to protect its citizens during health emergencies, natural disasters, or global supply chain disruptions. Global experience has shown that countries without domestic pharmaceutical production are more vulnerable during crisis, a lesson learned during COVID-19. Second, to position Tanzania as a major pharmaceutical producer and exporter in Africa. Our vision goes beyond meeting domestic demand. We aim to establish Tanzania as a manufacturing export hub for Africa, East Africa, and SADC, and the entire continent as well. This will place Tanzania firmly on the global map as a contributor to regional and international health security. Third, to promote the production of modern, next-generation medicines, advanced generics, is not a matter of preference. it is a matter of necessity. The reality is that many medicines available in African markets are based on outdated technologies that have long suppressed in developed countries. Yet medical science is advancing rapidly, continuously, improving treatment quality, patient safety, and cost effectiveness. By establishing modern pharmaceutical industries, Tanzania can transition from being a passive recipient of outdated medicines to an active participant in global medical innovation. Advanced generics offer improved efficacy, better drug delivery systems, more accurate dosing, and fewer side effects. In simple terms, better science leads to better outcome for patients. Let us speak honestly and boldly. Africa, including Tanzania, has for too long been treated as a market for old generation medicine. While these medicines have a role, the world has moved forward, and too often we are left receiving what others no longer prioritize. Africa must no longer be the last destination for yesterday's medicine. This reality has reinforced the perception of Africa as a terminal market, rather than an equal partner in medical advancement. As a result, patients frequently receive less effective treatments, even as the disease evolves and demand therapies that are safer, more precise, and more effective. The disease does not still stand, and neither should the medicine we use to fight it. Worse still, reliance on imports has contributed to the circulation of substandard medicine products, medicine that do not meet quality specifications are not manufactured according to good practices. Our lack stability throughout their shelf life, such products do not merely fail to heal, they actively endanger lives. The impact of Tanzanian lives is profound. Substandard medicine lead to treatment failure, prolonged illness, drug resistance, and preventable deaths. For patients, this means physical and psychological suffering. For families, endless financial burdens, and for the nation, lost productivity. These rising healthcare costs and erosion of public trust in health services. Poor quality medicine cost more than money, they cost lives. That is why strategy to promote modern pharmaceutical manufacturing, encourage advanced generics, and enforce international standards such as WHO, GMP, is not just an industrial agenda. It is a national decision to protect lives, improve healthcare quality, and permanently remove Tanzania from the cycle of dependence on outdated and poor quality medicines. This is not about factories alone. It is about dignity, safety, and the right of our people to world-class healthcare. Honorable guests, distinguished investors, ladies and gentlemen, as we all understand, global competitive pharmaceutical sector depends on coordinated action between the public and private sectors. The government is focused on putting in place the necessary infrastructure, aligning policy and regulation, and ensuring a stable and predictable market environment to support local pharmaceutical manufacturing. The forum comes at a moment, providing opportunity to examine how government-led infrastructure, readiness, and market assurance can support increased local manufacturing, research and development, technology transfer and investment, with direct implication for health security, economic growth, job creation, and industrial development. It is against this backdrop that I'm pleased to announce a major step in Tanzania pharmaceutical industrialization agenda, and this is the establishment of pharmaceutical manufacturing hub clusters at Mloganzila and Kibaha. These hubs are being developed as integrated ecosystems, bringing together manufacturers, regulators, research capacity, and logistic infrastructure in one coordinated platform. This cluster-based approach reflects proven global practice where pharmaceutical hubs have reduced production costs, accelerated the regulatory process, and enabled manufacturers to scale efficiently while meeting international quality standards. To support these ecosystems, I'm also announcing a $10 million a government-backed investment in a shared pharmaceutical laboratory facility, serving both clusters. This facility will provide advanced quality testing, bioequivalence studies, and regulatory support, shared manufacture that lowers entity barriers, shorten times to market, and strengthen compliance with WHO, PQ, and GMP requirements. Alongside infrastructure investment, the government is also committing to a clear policy framework for market protection. For investors, let me be clear on policy protection. Once local manufacturers achieve internationally recognized quality standards, government will align procurement, tariff, and regulatory instruments to prioritize quality-assured local production, ensuring market stability, predictability of demand, and fair competition against imports. This is the rules-based framework anchored in quality and performance, not discretion, distinguished investors. As I've already stated, and let me emphasize again with full clarity, market certainty is non-negotiable. I will repeat. Market certainty is non-negotiable for serious pharmaceutical manufacturers. Tanzania is not inviting you to invest and leaving you exposed. Once you invest, comply with WHO pre-qualification and GMP standards, and manufacture competitively in Tanzania, the government will actively protect your market position. The government will protect your market position. And this includes structured market assurance through public procurement, preferential treatment for locally manufactured, quality compliant products, fiscal and tariff instruments to prevent unfair import competition, regulatory enforcement against substandard and dumping practices. Allow me to state this point with absolute clarity. No investor will be asked to build factories in Tanzania only to be frustrated by unfair imports. That era is over. I will repeat. No investor will be asked to build factories in our country only to be frustrated by unfair imports. That era is over. And further, we will use all lawful power of the state, policy, regulation, procurement, and taxation to protect serious pharmaceutical investments. Importation will not be allowed to undermine, delay, or suffocate domestic manufacturing. Our ambition is simple: medicines made in Tanzania, trusted in Africa, and accepted globally. Therefore, our objective is clear: to make Tanzania a reliable, competitive manufacturing base for quality assured medicines, serving domestic demand while unlocking regional and international export markets. Government is investing alongside the private sector to reduce risk, enhance predictability, and create an environment where capital, technology, and skills can scale with confidence. And this is not a pilot. It is a long-term industrial commitment. We invite you to partner with us. We invite you to partner with us in building pharmaceutical manufacturing ecosystem that is commercially viable, globally compliant, and strategically positioned for Africa's growing health markets. Honorable guests, distinguished investors, ladies and gentlemen, as I conclude, allow me to extend an invitation grounded in clarity, commitment, and confidence. Tanzania has made a deliberate and irreversible choice to invest in modern pharmaceutical manufacturing as a pillar of health security, industrial growth, and regional leadership. We have aligned policy, regulation, infrastructure, and political will to support those who are ready to build, innovate, and produce. The opportunity before you is not theoretical. The market is real. The demand is growing. The regulatory pathways is clear, and the government stand ready to work with serious partners openly, decisively, and in good faith. This is an invitation to invest not only in factories, but in a system that values quality, certainty, and a long-term partnership. For those prepared to manufacture locally, meet international standards, and think beyond short-term returns, Tanzania offers stable platform for growth, expansion, and regional reach. We invite you to grow with us, to produce with us, and to shape the future of healthcare in Africa with us. Honorable guests,